Good afternoon. My name is Alex. I'll be the nurse performing your physical assessment today. Can you please give me your full name and your age?
Mike Smith, 24.
Perfect. Okay, patient appears to be alert. He is presenting with clear speech. He's sitting upright with a smiling, cheerful expression. He appears well nourished and well groomed. Next, we're going to move on to the skin. Skin is dry and intact. There do not appear to be any bumps, lesions, bruises, scars, or scabs. Next, we're going to move on to the face. Face is symmetrical. There is no drooping on the right or left side. Next, Mr. Smith, I'm going to palpate your scalp to feel for any bumps or lesions. Good, no bumps or lesions noted at this time. Next, Mr. Smith, I'm going to have you clench your teeth for me and stick out your tongue. Perfect, facial expressions are symmetrical. Next, I'm going to palpate your sinuses. Please let me know if you feel any pain or discomfort.
No.
Excellent. Next, I'm going to move on to your eyes. I'm going to have you look right at my nose. I'm going to shine a light in your eye. Good. I'm going to take a look at the inside. Excellent. Eyebrows, eyelashes, and eyelids appear within defined limits. The hair is evenly dispersed. Sclera is white. Conjunctiva is pink and moist. There does not appear to be any excessive discharge or inflammation. Next, we're going to move. Pupils are equal, round, and reactive to light. They accommodate. Corneal reflex appears to be within normal limits. Next, we're going to do the cardinal directions. I'm going to have you follow my pen with just your eyes. Good. Patient does not appear to have any difficulty following my pen. Next, Mr. Smith, I'm going to have you cover one of your eyes and read the top line.
QTRXY.
And cover the other eye. Read the bottom line.
SYADF.
Excellent. Patient does not appear to have any difficulties with the vision. Appears within normal limits. Patient does not wear contacts or glasses. Next, we're going to move on to the mouth. Can you open wide for me, please? And say ah. Good. Lips appear pink and moist, no dryness or cracking. Teeth are intact and white. Inside the mouth is pink and moist, no lesions are noted. Tongue is pink, moist, and intact. Gums are pink, moist, there's no bleeding present. Tonsils are pink and moist, they are of appropriate size. And uvula is midline, symmetrical, and rises with vocalization. Okay, next we're going to move on to the nose. The ears. We're going to move on to the ears. Outer ears are within defined limits. They are intact. There's no drainage noted. Next, I'm going to feel your outer ears and your targus to see if there's any pain or discomfort. Any tenderness?
Nope.
No, excellent. I'm going to move on to the nose. Next, nose looks midline. Please let me know if you feel any tenderness or pain.
Nope.
Okay. Have you plug one nair and breathe. And the next. Good. Nostrils appear patent. There does not appear to be any septal deviation. Next, we're going to move on to the neck. Neck appears within defined limits. I'm going to feel for your lymph nodes, preauricular, postauricular, occipital, posterior cervical chain, anterior cervical chain, tonsillar, submandibular, submental, and supraclavicular. Any pain or tenderness with that?
Nope.
Excellent. Next, I'm going to put my hands on your shoulders. Can you shrug upward? Good. Next, I'm going to have you move your head up and down. Your to shoulder. And rotate. Good. Range of motion appears to be within normal limits. Next, I'm going to move on to your carotid pulses. Carotid pulses are equal and 2 plus. And next we're going to move on to the posterior back. And actually I'm going to backtrack. I'm going to palpate your trachea. Trachea is midline, no enlargements are noted. Now we're going to go to the posterior chest. I do not note any abnormalities. Skin is dry and intact. Next I'm going to test chest expansion. Can you take a deep breath for me? Good. Chest expansion is equal on both sides. We're going to do test tactile permeatus now. When you feel my hands on your back, I want you to say 99.
99, 99, 99, 99, 99.
Good. Okay, next I'm going to percuss your lung fields. Good. Now I'm going to percuss your CVA. Please let me know if you feel any pain.
Nope. Nope.
Good. I'm going to auscultate your breath sounds now. Lung sounds are clear and equal bilaterally. Next, we're going to move on to the anterior chest. The anterior chest appears symmetrical. No deformities are noted at this time. I'm going to listen to the lung fields in the front now. Deep breath. And I'm back. Good. Lung sounds are clear and equal bilaterally in the anterior chest. Okay, next we're going to move on to the heart. I'm going to feel for your apical pulse. I don't feel any thrills or heaves. Next, I'm going to listen to your heart sounds. First, I'm going to auscultate the aorta, pulmonic, Erb's point, tricuspid, and mitral. I'm going to flip around to the bell, aorta, pulmonic, Erb's point, tricuspid, and mitral. Okay, sounds are all regular. No murmurs detected. S1 and S2 are audible, and no extra heart sounds are noted. Okay, next we're going to move on to your upper extremities. I'm going to take a look at your skin first. Skin appears dry and intact. No bumps, lesions, bruises, scars, or scabs noted at this time. And take a look at your fingernails. Nail beds are pink. Cap refill is less than 3 seconds within normal limits. Next I'm going to palpate your radial pulses. Pulses are equal and 2+. Okay, next I'm going to have you put your hands out to your side and over your head. Any pain or difficulty with that?
Nope.
Good. Okay, next I'm going to have you lay down. Okay, I'm going to first auscultate the aorta for any bruit. Good, now I'm going to listen to your bowel sounds. Okay. Bowel sounds are audible and normal active in all 4 quadrants. Next, I'm going to percuss your bowels. Good. And now I'm going to palpitate. Please let me know if you feel any pain or discomfort.
No. No.
Okay, I'm going to go a little deeper now.
No. Nope.
Okay, good deal. I'm going to move on to your legs. Skin appears dry and intact. No bruises, bumps, lesions, or scars noted at this time. I'm going to palpate for your tibialis anterior pulse. Dorsalis pedis. Both pulses are equal and 2+. Next, I'm going to do your hips. Test your range of motion. I'm going to lift up your leg and bend your knee to your chest. Out and in. Good. And relax. And do the other hip. Up towards your chest. In and out. Good. Okay. Now I'm going to have you sit up. Okay. Now we're going to move on to neurological function. We're going to check your cerebral function first. I'm going to have you put your hands out like this and flip them over and faster. Good. Next, I'm going to have you take the heel of your foot and trace it down your shin to your ankle. Other one. Good. Okay. Next, I'm going to have you close your eyes. Please let me know when you feel the cotton ball and where you're feeling it.
Left cheek. Right cheek. Right arm. Left arm. Right hand. Left hand. Right leg. Left leg. Right foot. Left foot.
Excellent. You can open your eyes. I'm going to check your reflexes now. I'm going to do brachial first. Good. Good. Patellar. Good. Good. Check the Achilles. Good. And plantar. Good. Good. Excellent. I know that tickles. Okay. And next I'm going to have you get up and walk across the room for me. Good. And walk on back with heel to toe. Good. Alright. Good. Gait appears within defined limits. Next, I'm going to have you put your arms out to your side and one leg up and close your eyes. Excellent. All right, next I'm going to have you turn around. Spine appears midline. I'm going to have you bend forward for me. Okay, and now side to side. And rotate. Excellent. Range of motion of the spine appears within normal limits. All right, that concludes the end of my physical assessment. Do you have any questions for me?
Nope.
Excellent. Thank you.
Thank you.